I think bioelectric medicine is a big category. So whether it's accelerated TMS or focused ultrasound, where you might take something that looks like a hockey puck and put it over your liver, for instance, or spleen to affect various things. Using microchips over pills, I think is going to be a huge growth area, and that we'll realize more and more how much is dependent on the immune reflex and different types of communication mediated by electricity that can be affected by external or internal devices like an implant. So for instance, I'll give you a wild factoid, which is people may have heard the story, which is based on real science, where you transplant the microbiome from, say, obese mice into lean mice, and those lean mice then become obese just by transplanting the gut microbiome. If you sever the vagus nerve before you do the transplant, that doesn't happen. They don't become obese. So what's happening there? It would seem that the microbiome is communicating with the brain vis-a-vis the vagus nerve. And I think many of the assumptions that we have currently, which form the bedrock of our quote-unquote understanding of mental illness and so on, are just going to be completely false. They're going to be completely untenable within 10 years. A lot of that, I think, is going to be driven by a better understanding of the body electric. It will be driven by better understanding of how fuel utilization in the brain drives many different psychiatric conditions that can be mitigated or completely addressed by, say, providing an alternate fuel source instead of glucose ketones, right? Well, maybe there are other options for achieving ketogenic-like effects, such as systemic anti-inflammation, with the use of electricity instead of diet, right? I think that's possible, and I've invested in a few companies that are aiming to do that, which is very exciting because it means that you might have options for affecting brain function that do not require you to take molecules that get into your brain directly. Mm-hmm. That's really exciting. So bioelectric medicine, I think, is going to be a very exciting space to watch.